Hip fractures are one of the most severe fall injuries in older adults. As the average lifespan increases, hip fractures also increase yearly. In the United States, the number of hip fractures in individuals 65 years of age and older is reported annually at more than 300,000, and the number is estimated to be over 1 million worldwide. The treatment period is very troublesome for the patient and their relatives. Even if the treatment is done the best way, many of them may not be able to live independently. In this video, you'll find 5 recommendations to prevent yourself from hip fractures that can occur later in life. The risk of developing a hip fracture increases as people get older. Because as age progresses, the risk of hip fracture increases with simple falls because of osteoporosis. Moreover, since balance problems that cause falls are more common in older ages, the risk of hip fractures increases. 95% of hip fractures usually occur with simple falls when the elderly who lose their balance fall sideways. Do you know that 3/4 of all hip fractures occur in women? The first reason for this is that women fall more often than men. Secondly, osteoporosis, which weakens bones and increases the likelihood of fractures, is more common in women and occurs earlier. The CDC is an organization that makes recommendations for the control and prevention of diseases in the United States. By the following 5 CDC recommendations in this video, you can reduce the risk of falling or strengthen your bones and reduce the risk of hip fractures. You can ask your doctor to assess your risk of falling. In particular, the presence of inner ear and neurological disorders cause vertigo and balance problems that may cause falls and can be diagnosed and treated. Ask your doctor to review any medications that may cause dizziness and sleep. The interaction of different drugs given by separate physicians without knowing each other, some medicines can have dangerous effects. Vitamin D has an active role in bone metabolism. If vitamin D supplementation is necessary, follow your doctor's recommendations. Get screened for osteoporosis and get treated if needed. On the other hand, the most important fact you should not forget about healthy living is that prevention is much more effective than treatment. Therefore, do not neglect age-appropriate sports starting from the ages when you are healthy so that you never experience a loss in bone density. As we get older, there is a decrease in muscle mass. We call this sarcopenia. Frequent falls are inevitable if there are balance problems in addition to sarcopenia. To prevent these problems, do exercises that strengthen the leg muscles and improve balance. Tai Chi is an excellent example of this type of exercise. Don't forget that group activity also works as great socialization activities for older individuals. If you have vision problems, possible obstacles in your path can cause frequent tripping and falls. For this reason, do not forget to be examined by an ophthalmologist at least once a year. Make sure your glasses are appropriate. Bifocal lenses used for both near and far vision can cause objects to appear closer or farther away than they are. Especially for outdoor activities, a pair of glasses with the appropriate one is much more suitable. On your way to the bathroom at night, get rid of obstacles you might trip and fall on. Add grab bars inside and outside your bathtub or shower and next to the toilet. These handles are helpful in both maintaining balance and creating additional strength for weakened leg muscles. Put railings on both sides of the stairs. Make sure the inside of your home has enough light by adding more or brighter bulbs. Despite all this, do not hesitate to contact a physician if you cannot bear weight on your leg after a fall and feel pain in your hip and groin area. Remember, patients whose surgical treatment is completed within the first 48 hours after hip fractures have much more successful treatment results. Don't forget to hit the like button and subscribe so you will not miss my videos with orthopedics, nutrition, and sports content. May you have active days when your face is always smiling and you do not have health problems.